claudication for last 3 years and aggravated for last 3 months. All the conservative treatment fails. You can see there is a L4 L5 severe lumbar canal stenosis with desiccated disc. There is a grade 1 lumbar spondylolisthesis. You can see this is a complete block seizures grade 4 type of the lumbar canal stenosis or LCS. And she is non-diabetic, non-hypertensive. At present there is no bladder bowel involvement, and patient is incapable of attending the natural call, severe pain and claudication. Claudication distance is almost homebound for 4 months, limping, and the incision is about 20 millimeter, 10 millimeter away from the midline. So the hemostasis is maintained with regular bipolar cautery. The deep fascia is cutting in the same line of incision with the Mayo scissor, and then in midline I am trying to detach the soft tissue from the midline, then trying to fill the superior lamina here. This is the superior lamina, and then the subfacial dissection with the chisel. Then we try to fill it. "63 years lady, osteoporotic bone, overweight, the gauze piece tied with a thread, pushing one cranially, one caudally to create a space for the point docking of the instruments. So cleaning of the soft tissue from the superior lamina. Cleaning of the soft tissue from the interlaminar window. No. Now docking of the instruments. So cleaning of the soft tissue, identify. You have to very precise, pinpointed, and anatomically very strong enough. The 45. Now we'll go for the first bite at the spinal laminar junction. Here. Very, very tight canal. So the flavum is now detached from the superior lamina at the spinal laminar junction. Gradually we are coming laterally. Lot of the superficial layer of the flavum, very, very thick. Osteoporotic bone, C65 and Sijas grade 4. This is stenosis. There. Now we come back to the inferior lamina where we are trying to detach the flavum here. Adaptation pasa. This is the foramen. So foraminotomy. This is my SAP, the superior articular process of the these are the deep layer of the flavum. That is the root. Yes, petty. This is my caudal petty. ठीक है, tilt करूँ.
मोड़ को tilt करो सब.
And this is my cranial petty. अटे तो दे दे very thick phloem here. We are going towards the midline. The disc also. Now we have to change the petty, repositioning of the petty, the spatula. Bring out your disc also. Very tight canal. Petty. She just grade 4, so you have to be careful about the the 45. Look at it. So this person. Petty. छोटा petty कर लो ना हो दे बड़ा. So I am trying to negotiate my petty at the midline, but it is almost like adherent. Very difficult to introduce. Very well, 45. So slowly we are going to the midline now. Very thick ligamentum flavum. ये बाहर ही होने से तो नौ नहीं तो उसका सफा करो very thick tight canal, thick ligamentum flavum. So there is bleeding, also a lot of bleeding is going on. So now almost we have crossed the midline. We are going laterally towards the right side. Now I have approached from the left side. Okay, there disperse है. छोटा पेटी. This. ଆସିକି ସଫା କର ଡିସ୍ଟା ଦେଖୁଛୁ ଜିନିଷଟା ବାହାରିନି ସଫା କରିଦେ ତାକୁ ହେଲ୍ପ କର ସେଠି ଛିଡ଼ା ହେଇକି ଗଣୁଛୁ କ'ଣ not able to negotiate my petty so much of tight calcified flavum लगा व्यवहार कले छिड़ी जाता डिस्कोर्स है चल गोटे छोट पेटी so much of tight canal is adherent calcified flavum it is not negotiable so even the dura is thinned out so much of tight canal This. Okay. Yeah. So sinking of the tissue of the opposite side, so that the visualization and the bleeding also, the hemostasis at the same time, this process. Pretty photo. No, not allowing my petty to go in. ତଳେ କୌଣସି ଜଣା ହେଲେ yes. Now nerve root is visible of the opposite side, most likely. Let's see. What? What? Yes, there is a nerve. Now I am on the nerve. Okay. So this is done now. Norwood is clear here. I can see my Norwood here. This, it is the SAP. Yes. With the opposite side foramen here. I'm trying to negotiate. With a good bite. The foraminotomy is done. Yes. It is a very nice bone. Deroofing. Yes. Very nice. Yes. There is the SAP of the opposite side. SAP of the opposite side is now clear. The hypertrophic medial aspect of the SAP. Yes. Now done. Altogether 45 to 2 mm. Or 90 to the other end. Yes. Yes. Good this process. The opposite side Norwood is now clear. There. Tilt ಮಾಡಬಹುದು. Though it was a very difficult case, we could manage to do that. Tilt करो ಮಾಡಬಹುದು. ಒಟ್ಟಿಗೆ तो पेटी दे बड़ा छोटा ज़्यादातर दे एक तो छोटा yes so nerve is in front of me दे 45 so nerve we have already seen foraminotomy a bit maybe the medial aspect of the SAP very nice very nice very osteoporotic bone this forceps was ಲುಕೋಡಾಗ್ರಿ ಇದೆ that was ಲುಕೋಡಾಕೋ there was दे कैमरा कोच पेटी दे रेडी शॉट करना रेडी रख से जो जल पे आप जला वो पेटी विथ रेडी रख दे दे काटे टका झाड़ियों को এটা এতে পাଗ করে ରଖିଛୁ ତାକୁ এটা ଗଳି ପଡ଼ୁଛି କାହିଁ ଛାତ କେଉଁ ଲଗେଇଛୁ କାହିଁ ଏଇଟା ଖୋଲା ଅଛି এটা ଲଗେଇନୁ ଟୋଟାଲ এটা ଏଠି ଦିଆଯାଏ ଜାଣିନୁ ଏଇଟା ମୋ ହାତରେ ଧରିଛି ମାନେ କ'ଣ କରିବି ଚଲ ଦେ ଚୁଲା ଦେଖାଉଛି ଚଷମା ପିନ୍ଧିଲେ ତ ଏଇଟା ହେଲା ଆପଣଙ୍କର ବୋନ୍ ଏଇଟା ହେଲା ବୋନ୍ ସ୍ପାଇନସ୍ ପ୍ରୋସେସ୍ ଏଇଟା ଫେସେଟ୍ ଦିସ୍ ଦ ଇନଫିରିୟର ଲାମାଇନା ଦିସ୍ ଦ ସୁପିରିୟର ଲାମାଇନା ଏଇଟା ହେଲା ସ୍ପାଇନାଲ୍ କର୍ଡ ତା ଚାରିପାଖେ ଯେତେ ସବୁ ଅପରିଷ୍କାର ଥିଲା ସବୁ ସଫା କରିଦେଇଛୁ ଏବେ ସ୍ପାଇନାଲ୍ କର୍ଡ ୟା ଦେହରୁ ନର୍ଭ ବାହାରିଛି ନର୍ଭଟା ହେଉଛି ଦୁଇ ସାଇଡ଼କୁ ଦୁଇଟା ଯାଉଛି ଏଇଟା ହେଉଛି ତୁମର ରାଇଟ୍ ସାଇଡ଼୍ ନର୍ଭ ରୁଟ୍ ଏଇଟା ବୁଝିପାରିଲ ଏଇ ଧଳାଟା ଏଇଟା ହେଲା ରାଇଟ୍ ସାଇଡ଼୍ ନର୍ଭ ରୁଟ୍ ଏଇଟା ଡିସ୍ପର୍ସିଭ୍ और इटा हूँ लेफ्ट साइड नर्व देख देखिल धड़ाटा देखिल यहाँ लेफ्ट साइड नर्व तो सब क्लीयर हो गला एकदम बढ़िया हो गला प्रेशर आउ कि ना पूरा फ्री हो गला यहाँ एकदम फ्री यहाँ भी फ्री यहाँ स्पाइनल कॉर्ड हाँ चलो बस चलो थैंक यू ट्रांसमिशन ऑफ